Hi, I'm Amy McCarter. Welcome to House Calls, brought to you by KaMMCO, where Kansas healthcare professionals deliver health insight. Today I'm speaking with Sarah Sachs-Jepson, family nurse practitioner, about shingles. And I've heard a lot recently about shingles. Can you tell us a little bit about the disease?
Sure. Shingles is caused by the varicella zoster virus, which is the same virus responsible for chickenpox. After a person has chickenpox, which usually occurs in childhood, the virus will lay dormant in the nervous system and can reactivate several years later, causing shingles. Shingles is a painful rash that typically develops in a single linear pattern on the side of the body along a nerve line called a dermatome. The rash blisters and then scabs over, and in about a week, typically resolves in 2 to 4 weeks. Generally, the person will experience pain, itching, or tingling a few days prior to the rash developing in the area where the symptoms began. It's estimated that 1 in every 3 people in the United States will develop shingles in their lifetime. Although shingles can strike at any time, it's much more common over the age of 60.
And is shingles contagious?
Shingles itself is not contagious. However, a person with active shingles can spread the varicella virus to someone who has never had chickenpox, causing that person to develop the classic chickenpox rash, but not the shingles rash. Unlike influenza or other respiratory infections, which are spread by coughing or sneezing, the varicella virus is spread through direct contact with fluid from the rash blisters. Shingles is not contagious before the blisters develop and is only transmitted during the blister phase. Once the blisters crust over, the person is no longer contagious. If you do develop shingles, the best way to prevent spreading the virus is to keep the rash covered. Don't touch or scratch the rash, and wash your hands frequently until your rash has developed the crust. It's also very important that you avoid contact with infants, individuals with weakened immune systems, and pregnant women who have never had chickenpox or the varicella vaccine. If you do develop shingles, there are several antiviral medications on the market that can help shorten the course and minimize the severity of the outbreak. To be effective, though, these medications need to be started as soon as possible after the rash appears. Pain medications can also be given, and I often prescribe topical lidocaine patches to help alleviate the pain. People who have the symptoms of shingles should call their healthcare provider as soon as possible to discuss treatment options.
So I know that there is a vaccine to prevent chickenpox. Would this also cover shingles?
That's a good question, Amy. The chickenpox vaccine is part of the recommended childhood vaccine schedule and is given in 2 doses, typically at 12 months old and again before entering kindergarten. This vaccine prevents the chickenpox disease, which will in turn eliminate the possibility of getting shingles as an adult because they were never infected with the chickenpox virus as a child. Now, in 2006, the FDA approved the Zostavax vaccine, which is specifically aimed at preventing shingles. Zostavax basically contains a booster dose of the chickenpox vaccine and is recommended in people over the age of 60 who have had chickenpox in the past. There are some contraindications to receiving this vaccine, so talk to your primary care provider about whether this vaccine is right for you.
Thank you, Sarah, for being our guest today.
Sure, Amy.
Please join us next Saturday morning for a new health topic discussion on House Calls.